This segment of DelmarvaLife is brought to you by Delmarva Dental Services.
Okay, so be honest. You ever done one of these? Be honest. Now, if you didn't like what you smelled, you got out a piece of gum, didn't you?
We don't think twice about gum. It's a quick fix for bad breath. Or maybe you chew gum because you're bored or it's just a habit. Well, regardless of why you chew gum, it's something so many of us do. Research shows in 2012, sales of chewing gum reached $3.5 billion. The average price of a pack of gum, a little more than $1.50. Look on the store shelves and you'll find so many different varieties of gum, from flavors to colors, even textures, and maybe you're familiar with some of the benefits of chewing gum. Yeah, it's supposed to help with concentration, appetite, even stress, but could your chewing gum habit also be hurting your health?
Chewing gum may just be a habit or an obsession.
Now this piece of gum here is one that I've been chewing on for 3 months solid, and that's a world record.
But either way, chewing gum can have some nasty consequences. 1, chewing gum could lead to gastrointestinal problems. When you chew gum, you swallow excess air, which can lead to abdominal pain and bloating. Also, chewing gum may cause you to eat fewer healthy foods. Researchers believe minty gums can give fruits and vegetables a bitter taste, making you want to eat junk food.
Another side effect, research has shown the act of chewing gum can release a small amount of mercury from silver teeth fillings into your system.
Ooh. So now the question is that stick of gum really worth it? Well, here to break it all down for us is Dr. Joseph Harmon with Delmarva Dental Services in Salisbury. Thanks for coming in. Appreciate it.
Thanks for having me.
Now, chewing gum is not something new. This has been going on for a long time.
People have been chewing gum for 5,000 years.
Okay.
The Aztecs chewed it, the Greeks chewed it, and they used to use sap from a tree.
Wow.
In fact, the original gum up until 1960 was made from the rubber latex plant.
Huh.
Really?
Interesting. So what do you make of these studies that say that, chewing gum can release mercury from your fillings into your system?
Well, every time you eat, if you have silver mercury fillings, it releases mercury vapor. And the question is it harmful or not? We receive more mercury from fish that we eat, but the study was that if they chewed 7 pieces of gum a day,
right,
and they released as much mercury as the high level of an occupational hazard, whereas if you worked at a factory that made mercury, that's the maximum level. So
you're running the same risk if you chew 7 pieces of gum?
The same risk, yeah, if you have silver.
If you have the silver.
Wow.
Now that's an industry standard.
Right.
It's not necessarily considered. It may not be harmful or it may be harmful. We don't know. The studies really haven't said that.
I'll be honest with you, I have a mouthful of fillings, and I got to a point where I wouldn't chew gum because I was afraid it was going to pop one of the fillings out. Does that really happen?
Well, usually if gum's going to pull your filling out, it was probably ready to come out anyway.
Oh.
But gum will stick to acrylic plastic, especially denture teeth, and you have to peel it off with your fingernail. It won't pull your teeth out, but it'll stick to it. It won't stick to metal, and it won't stick to porcelain or natural teeth, but it will stick to plastic.
Okay. Which is what most dentures are made of.
All dentures are made of plastic,
made of plastic
basically.
teeth, yes.
Okay, so what about gum causing stomach problems?
Well, there are several studies that say that it does, because what it does, it tricks your body into thinking it's eating. So it's going to produce acids and bile and things in preparation for food that's coming. So you would get excess, you can have ulcers, aggravated ulcers, it can cause reflux to get worse.
Right.
You can get from swallowing gum, you can get a stone, an intestinal stone. But there is an old wives' tale that said that you can't digest gum, and then if you eat gum or swallow gum, it'll stay in your stomach for 7 years.
Right.
But that's not true.
Oh, it's not true.
It goes right through. Yes.
I heard it went to your appendix. So.
Oh, see, I hadn't heard that one. Okay, so chewing gum. In your opinion, can it have effects on your jaw?
Well, your jaw is just like any muscle in your body or joint in your body.
Okay.
If you consistently ran, it could wear out your jaw or make it sore. So if you have headaches or migraines or you have muscle cramps or jaw pain,
right,
you probably shouldn't chew gum because it's going to aggravate that.
Okay.
Oh, okay. So there are benefits to chewing gum, right?
Yes. Gum stimulates saliva flow, and saliva will neutralize acid. And it could be acid from your bacteria from eating sugar, or it could be acid from drinks, colas and energy drinks, or it could be acid from fruit. It could be orange juice. So if you stimulate saliva flow, it neutralizes the acid and it does less damage to your teeth.
Fewer
So-
calories, or fewer
Fewer
cavities?
You could have fewer cavities, especially if because you're neutralizing that acid. And also, and your saliva serves as a lubricant. So people that have dry mouth definitely should chew gum because it helps coat their tissues, and then they get less ulcers and things like that. So it would be beneficial for those kinds of people.
Okay, we're all getting better at reading labels on things. Is there anything on the gum label that we should look for?
Well, xylitol is a very good sugar. It's a natural sugar, and bacteria can't use it to cause cavities. It actually causes bacteria to fall off of things, inhibits their adhesive properties. So xylitol is something would be good. I would avoid aspartame. There's a lot of controversy about artificial sweetener, aspartame. I would avoid that. The sugar is not that bad because the sugar dissipates so quickly that after a while you're not really having much sugar when you're chewing gum. So I wouldn't really worry about the sugar. But if you have a high cavity rate, definitely xylitol.
Are there any other foods that could hurt our oral health, our teeth?
Well, acidic foods like pickles and fruit, things like
I guess oranges there. We got one right there, huh?
oranges, colas, anything that's pickled. Basically what it does, it can dissolve our enamel. But if you rinse or drink water afterwards,
Right.
or chew gum, it can help lessen the effect.
But we shouldn't brush right after we eat like a pickle or something?
No, because what you're doing is you're acid washing your teeth. It's like if you want to clean your concrete, you would pour acid on your concrete and then
Right.
take a brush to it. Same concept.
Oh, so
which
we're
you're-
just spreading it around.
You're basically wearing away. You're making your enamel softer, and then you're taking a brush to it. So never brush your teeth after you've had an acid ingestion, whether it be a liquid or whether it be a food.
Get a piece of gum.
Yeah.
Dr. Harmon, thank you so much. Wonderful information for you this afternoon.
And to learn more from Delmarva Dental Services about dental health, go to DelmarvaLife.com and click on the show tab.